April is Autism Awareness Month, a time for understanding, embracing, and celebrating different ways of thinking and doing. In honor of Autism Awareness Month, I want to give an overview of the 3 levels of autism. Now, autism is defined as a neurodevelopmental disorder characterized by impaired social interaction, verbal and nonverbal communication, and by restricted and repetitive behavior. Before 2013, 5 different subtypes of autism were classified under pervasive development disorders, or PDD, according to the American Psychiatric Association. They were autistic disorder, Asperger's syndrome, childhood disintegrative disorder, pervasive developmental disorder not otherwise specified, and Rett syndrome. 4 of these subtypes have now been replaced with one central diagnosis of autism spectrum disorder, ASD, under the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Rather than a distinction between different subtypes, ASD is now differentiated based on 3 levels of severity and support needed. Level 1 requires support. Level 1 ASD reflects the mildest form of autism. People with Level 1 ASD may have a hard time communicating with neurotypical people, including their peers. For example, they may not say the right thing at the right time or be able to read social cues and body language.
And what kind of doctor removes shoes from asses?
Depending on the depth, that's either a proctologist or a general surgeon.
The tendency to become focused on certain topics or objects can result in challenges with organizing material and following instructions. They can function in social and school settings if they have support to help with social skills and keep them on track. Level 1 is also referred to informally as high-functioning autism. However, there is a stigma regarding this term in the autistic community. Symptoms that may be associated with autism level 1 include trouble conversing with others, ability to communicate with others but may struggle to understand others' emotions, shows ability to make interests known but those interests may be unusual or not age appropriate, and understands what others are saying but tends to be very literal in interpretation. Level 2 requires substantial support. The biggest difference between levels 1 and 2 is that those in the second category struggle more noticeably in social situations. Sometimes level 1 individuals can mask their symptoms so much that others may not be aware that a person is autistic. Those in level 2 are typically unable to do so, but may still be motivated to appear neurotypical, or not displaying or categorized by autistic or other neurologically atypical patterns of thought or behavior. People with level 2 ASD require more support than level 1 individuals, as it is difficult for them to complete tasks without having someone nearby to help. When they come across challenges or concepts that they do not understand, they may express anger or frustration. This could be in the form of yelling or aggression. Individuals level 2 ASD are more likely to experience extreme distress from changes to routine or attempts to redirect their focus from their interests. Symptoms indicative of level 2 autism may include participating in conversation but then walking away, inability to redirect focus on special topics or interests, yelling when facing challenges that are not obvious to others, refusing to accept even small changes in routine, repeating phrases from favorite movies or shows without showing clear recognition of what they mean, and preferring to be alone even when around others who show some interest in interacting. Level 3 requires very substantial support. People with level 3 ASD need the most support and are therefore at very high risk for neglect, abuse, and discrimination. People in this category will have many of the same traits as those with levels 1 and 2, but are entirely unable to mask and have very high burdens of self-regulation. They typically have very little, if any, verbal communication skills. They may need to use augmentative and alternative communication devices to express their needs if they are nonverbal. Level 3 individuals find even the slightest changes in routine extremely upsetting and may become disruptive when these occur. Difficulties handling certain textures and tastes, referred to as sensory processing disorder, is common for many people with autism. However, those in level 3 may experience frequent meltdowns or outbursts when they encounter unfavorable sensory stimuli. Additionally, dealing with loud noise or a lot of activity can be especially challenging for level 3 individuals. Symptoms consistent with level 3 autism may include total or almost total inability to verbally communicate, need for devices to help with any type of communication, responsive only to very basic verbal and nonverbal instructions, anger outbursts at the slightest changes in noise or activity level, unwillingness to eat any food of certain texture, responding very little or not at all to their social environment. The 3 ASD levels give a basic outline of the ways people with autism may communicate, socialize, and behave. Assigning people to one of the 3 levels of autism can be useful for understanding what types of services and supports would serve them best. However, it won't predict or account for unique details in the personality and behavior, which means the support and services they receive will need to be highly individualized. Thanks for watching. Resource links can be found in the description below. Please hit that like button and leave your comments. Together, we can change how the education system works.